tonight to just give you a little information about COVID-19 for children. We have today Dr. Shah, who is our family medicine physician at Heartland Health Center, and he will be he's going to be giving the presentation today. If you have any questions, please feel free to put in the chat, and also keep your camera and yourself mute. Go ahead, Dr. Shah.
Thank you, Stephanie, and welcome everyone. Thank you for joining us. Again, my name is Dr. Shah. I am a family and integrative medicine provider at Heartland Health Centers. I work in the Lakeview location, and as Stephanie had mentioned, we're going to be doing a presentation on COVID-19 vaccine for children. We're going to do a brief presentation, and then we'll pause for any questions that might come up and do a little question and answer. And I want to talk about resources. And I think this is important because I think we get our information from a lot of different sources, right? We get information from Facebook, as you might be watching us on Facebook Live, from YouTube, get it from Instagram, TikTok, you get it from your neighbor, from your grandmother. All these places are sources of information, and they're out there and they're real. But it's when we're talking about things when it comes to health and vaccines, it's important to verify your information. And so, and in doing so, do so at sources that you trust. So sites that I look at are the CDC, the Center for Disease Control and Prevention, which can be found at www.cdc.gov, or the Chicago Department of Public Health, and there is their website right there. These are great websites to look at for the public, for providers, to find up-to-date information when it comes to vaccines or when it comes to COVID-19 in general. Most if not all of my information in the slides that I'm presenting tonight come directly from the CDC or from the Department of Public Health in Chicago. And starting off in Chicago, you can see a snapshot of the average daily cases that we're seeing here in Chicago. And as we all know, it's in the news right now. The case rates are climbing exponentially right now, and in ways that we haven't seen since the start of the pandemic. So this is a really scary graphic for sure. Here you can see the number of 7-day rolling average cases since the start of the pandemic, and we're spiking higher than when the pandemic started. And whether we're going to reach peaks as we saw a year ago, unclear, but it is something that we're keeping an eye on, and it's very worrisome. This is likely due, and what we're seeing is because of the Omicron variant, and it's spreading fast. The good news is that we're not seeing death rates in the way that we saw them when the pandemic started. And we're not seeing death rates right now like we did a year ago. Now, who's to say what's going to happen a couple months from now? But from all the data that we're getting from South Africa, it seems that although case rates are going really high, the death rates don't seem to be spiking as high as they did in the past. So this is some good news that we're hoping for. For the purposes of this presentation, I want to focus on children. And, I've heard from the community, I've heard people say, well, children aren't getting COVID-19, so they don't really need to get vaccinated, or it's not something that's happening in children. And that's just not true. So this is a current daily averages of cases here in Chicago. And you can see on the left side of the leftmost graphic, in children who are between the ages of 0 and 17, the average daily case rate is about 255. So it is on par with people who are in their 30s. And you can see that the most number of cases that are being reported here in Chicago are in people less than 40 years old, and a third of that is happening in children less than 17. Now, once again, the good news here is that hospitalizations in this age range between 0 and 17 is quite low, with the current daily average about 1.4. So, less than 2 a day are being hospitalized here in Chicago in this age range. And we're not seeing very many deaths at all in this age range because of COVID-19. So that's all really good news. But we are seeing the death rates in people who are in the geriatric years, greater than 65, 70 years old. We are seeing death rates in those populations. So the FDA has given emergency authorization for use of the Pfizer vaccine in children ages 5 to 15, and it's full approval in use of people who are greater than 16 years old. And we expect that most likely full approval will come for the Pfizer vaccine for all people greater than 5 years old. It is only the Pfizer vaccine that is approved for children greater than 5 years old, not the Moderna nor the Johnson & Johnson. The Moderna and Johnson & Johnson are only approved for people older than 18 years old. But as of now, the Pfizer is approved for everyone who's greater than 5 years old. And we're doing really well in vaccinating people here in Chicago in this age range and in general. These are the vaccination rates as of December 16th and in Chicago. And you can see that as of December 16th, almost 30% of children between the age of 5 and 11 years old have gotten at least one dose. And about 70% of children between the ages of 12 and 17 have gotten at least one dose here in Chicago. And that's really great. I mean, and we see here, up almost greater than 90% of people who are greater than 50, who are between the ages of 50 and 59 have gotten at least one dose. So we're doing really, really well when it comes to vaccinating our population here in Chicago, and children are getting vaccinated. So that is really good news. There is a racial disparity that we're seeing in Chicago. So people, Chicagoans of Asian non-Latinx descent have the highest rates of vaccination in Chicago, where it's 77% have gotten at least one dose. And that's compared to Black Latinx population here in Chicago. 54% of people have gotten at least one vaccine, and 65% of people who are in the Latinx population. So there's more work to be done in making sure that access is available in all communities, as well as information that people need. So why should children be vaccinated? Well, as we saw before, children are as likely to be infected with COVID-19 as adults. And although we're not seeing the hospitalizations and death, they can get very sick from COVID-19 and have both short and long-term health complications. So although we're not seeing people in the hospital, that's not to say that people aren't getting very sick. And what I think is crucially important is that children can spread COVID-19 to others. So when we're thinking about people in the home, we're thinking about others in the school, people who have a weakened immune system, or their grandparents or other people in the community who might be of older age. Children are a big source of spreading this virus in the community. So it's very important, as much as possible, to get everyone vaccinated to stop this pandemic. And what we see is that the vaccine is working against infection. So here in Chicago, since the week of Thanksgiving, infections are 3 times as likely in unvaccinated Chicagoans than in people who are fully vaccinated. So the red line is the rate of infection here in Chicago over the last several months. And you can see that those who are fully vaccinated, yes, the amount of infection is increasing, but at rates much less than what we're seeing in the unvaccinated population here in Chicago. And what's even more striking is the death rates. The death rates remain higher among unvaccinated compared to fully vaccinated Chicagoans. And since the week of Thanksgiving, the risk of death from COVID-19 is 5 times greater if you're unvaccinated than if you're not fully vaccinated here in Chicago. So this is very striking that vaccination is protecting us from the virus and protecting us from death. Now, it is true that we are seeing a lot of breakthrough infections, especially given this new variant of Omicron, but we are seeing protection overall, and these other viruses, variants are not gone. They're still around. When we think about comparing the vaccine that we have for COVID-19 to other vaccines that we give our children, let's take a look at the disease burden prior to having the vaccine available. So, for example, in the 90s, before we were vaccinating everyone for hepatitis A, but we were having about 3 deaths per year in people under the age of 20 from hepatitis A. If you look at the chickenpox, varicella, we started vaccinating people in the 90s from that. And before people were fully vaccinated, we had 16 deaths per year. 16 deaths per year from people with chickenpox. And now everyone is vaccinated with varicella. You look at something like rotavirus. In the 80s, in the 90s, we introduced that. In the 80s to 90s, you had 20 deaths per year from rotavirus. And now everyone is vaccinated from that. If you look at COVID-19 in children between the ages of 5 and 11, we're having 66 deaths per year in this last year, in October to October. So 66 deaths. So the disease burden, the death burden from COVID-19 is much greater than any of these other diseases that we vaccinate against. How much does it cost? Well, the federal government is providing the COVID-19 vaccine free of charge to all people living in the United States, and that is regardless of immigration or health insurance status. So as long as you live in the United States, you can go to a pharmacy, call your physician, call your doctor's office, or at Heartland Health Centers to get a vaccine. The vaccine is showing to be safe. Now, remember that there have been many clinical trials with thousands of volunteers showing the Pfizer COVID-19 vaccine to be safe and effective for all populations, and specifically for this population of children 5 and up. This technology is one that's decades old. We've been seeing and studying this technology for many years in the lab. What is new is putting this technology in use in a great scale like we are now. But the CDC continues to monitor the vaccine for safety, and they have so far identified no concerns for long-term impacts. And when you think about the millions and millions of people who've gotten this vaccine so far, and an active reporting process that is going on, that rests me assured about the safety of these vaccines. Children between the ages of 5 and 11 do receive a lower dose than adults. But those who are greater than 12 years and greater receive the same dose as adults. And the dosing is more than one shot. So there is a second shot that people need 3 weeks after the first shot. So you get your first shot, and then 3 weeks later, you get your second shot. And you're not considered fully vaccinated until 2 weeks after the second shot. So you get your first shot, then 3 weeks later, you get your second shot, and then 2 weeks after that, you're considered fully vaccinated, because it takes time for the body to build protection after any vaccination, not just the COVID-19 vaccination. For teenagers greater than 16 years old, so 16 and 17 years old, they can receive a Pfizer booster shot at least 6 months after their second shot. So again, you get your first shot, 3 weeks later, you get your second shot, and those who are 16, 17 years old can get a booster after 16 years, after 6 months. We all want to know about side effects, right? So we do know that children can get side effects, but we're seeing that children are getting fewer side effects than adolescents and younger adults. So children seem to be pretty much spared from the side effects, which is great. And those children who have had prior infection seem to be having fewer side effects than those who have never had the virus at all. So if you're worried that, oh, my child already had the infection and I don't want to have them go through side effects again, we're actually seeing that they're not getting the side effects as much as maybe someone who hasn't had the infection. The side effects seem to be more common after the second dose, and the side effects that we're seeing seem to be very, very mild. And like we're saying, like I said, we're not really seeing very many side effects at all in children. The side effects that we are seeing are very mild, pretty much at the site of the injection. We're seeing some pain, some redness, maybe some swelling at the arm. This can happen with any shot. We're seeing that with COVID-19 shots sometimes. It is possible, however, to get other systemic effects, meaning in your whole body. You can get tiredness, fatigue, muscle pain, headache, fever, or nausea. These side effects tend to last a couple days and resolve honestly within about 24 hours of having these symptoms. There's a lot of information on the news and on social media about myocarditis and pericarditis. So what is it? Myocarditis is an inflammation of the heart muscle, and pericarditis is an inflammation of the outer lining of the heart. And we have seen that it has been reported in young children between the ages of 12 and 17 who received the Pfizer vaccine. What's important to note is that the reports are very rare. So we're pretty much seeing this in almost exclusively seeing it in males between the ages of 12 and 17. We're not seeing it in people younger than 12. And in one study, they looked at over 1 million doses administered to males between the ages of 12 and 17. There were 54 cases. So it's a very rare occurrence, very, very rare. And what's also vitally important to remember is that myocarditis and pericarditis are a risk of COVID-19 infection. And your risk of getting myocarditis is greater if you are infected with COVID-19 than it is if you get the COVID-19 vaccine. I'm going to say that again. The risk of myocarditis after getting the vaccine is lower than getting myocarditis if you get the COVID-19 infection. So yes, there is a risk. It's very rare, 54 in every 1 million doses in males between the ages of 12 and 17. And the risk is greater if you have the infection. So the virus is protective. The myocarditis that we're seeing is also very mild. So it's often even just treated at home. A lot of children don't even need to go to the hospital for it, or they're treated outpatient. So it's something that is self-resolving. So if COVID-19 is something you want to get vaccinated against, please call our hotline at 872-250-6637 for an appointment. And that is our COVID hotline where you can get information about a COVID-19 vaccine. And this is only available for our current patients. If you are not a patient of Heartland Health Centers, you would call 773-751-7800. And to schedule an appointment, you can say that you're not a patient of Heartland, but you would like to get a COVID-19 vaccine or whatnot. They will schedule you appropriately, and then you will be treated therein. So with that, I'm going to pause and see if there are any questions that ended up in the chat, or if any questions that we want to address right now.
Yes, we have. So there are common questions about parents asking, can my kid get the COVID-19 vaccine at the same time as other shots like the flu?
Yeah, that's a very good question. Yes, this has been studied, and right now it is recommended to get all the shots together. There haven't been any reports of anything that the immunity wanes or that the immunity is any different if you get the COVID-19 shot at the same time as others. So go ahead and get them all at the same time.
That's great. Sometimes parents would like to vaccinate their kids, but they don't understand how vaccines works. So can you give us a little overview of how vaccines works?
Yeah, so the way that the vaccines work is the vaccine causes the immune system, which is your defense system, to recognize infection or recognize something that's going to happen and mount a defense. So that if your body is presented with a virus, it already has a defense system and it says, "Oh, I know what this is. I've seen this before. I have a whole armory, I have a whole defense system against this and I can attack." So with the COVID-19 vaccine in particular, it introduces it introduces information for the body to create a defense against what's called the spike protein, so part of the virus, so that when the body actually sees the virus itself, then and the virus has a spike protein, all the viruses do, the COVID-19 viruses do, then the body can attack it. So just to reiterate, the vaccine itself does not have any virus in it. It doesn't have any disease in it. All it has is information to deliver to ramp up the immune system so that in the future, if your body does see the virus, it knows what to do.
Great. Um, Now with the new variant Omicron, how effective or how safe are to get vaccinated? Like how well protected I will be if I get the vaccine now that we have Omicron around us?
Yeah, that's a very good question, and I don't have an answer. And I think this is something they're still looking at. What's really unique about, there's several things that are unique about this Omicron variant. One of them is that it's spreading very rapidly. And the second is what we were just talking about, that spike protein. So our vaccines right now create your body to defend against anything that has the spike protein that we've seen before. This variant has a very different spike protein than the other variants that we've seen so far. So it does seem to be evading our defense systems a little bit, where people who have been fully vaccinated and who have gotten the booster still are getting infected with the variant of Omicron. However, are we are seeing that there is less infection in general, and the other thing to know is that the other variants are still around, and one thing that I personally get worried about is people who might get doubly infected with two variants at the same time, and what that could cause down the line. We are still recommending that everyone gets vaccinated um, um, with the vaccines that we have available.
Yeah, thank you so much, Dr. Shah, for your presentation and answer these questions. I don't have no more questions in the chat or on Facebook, so that concludes our presentation for tonight.
Thank you. Thank you everyone for joining us, and definitely let us know if you have any questions, and you can call our hotline or make an appointment.
Thank you.